For me, this vaccine means hope. It will protect you and those you love from this dangerous and deadly disease. It could save your life. But even after people receive it, we still need to do the simple things that we know work. Wear a mask. Practice social distancing. And wash your hands. This is our shot. Now, it's up to you.
Hello. I love seeing our forever president, Obama, speaking to us that way. And welcome to this incredible Black media panel this afternoon. Thank you for being here. Today's conversation is exclusively for Black media and the Black community, brought to you by the Ad Council, COVID Collaborative, and Joy Collective, a Black and women-owned agency focused on impact building located in Washington, D.C. In the next 45 minutes, we will hear from incredible media powerhouses, The Shade Room, Bossip, and Global Grind, along with executives from the Ad Council and a medical expert who will be here to answer questions from our media panelists. And now, without further ado, I'm delighted to introduce our guests today and to get the panel started. First, we have two incredible sisters who are charting our path at the Ad Council, Sherry Thompson and Charisse Nunez. Sherry Thompson is the Ad Council's coalition building lead for the COVID-19 vaccine campaign. She's a God-fearing engineer turned marketer who now lives more on purpose every day as she helps to transform the lives of women and men in the area of health and wellness. She was formerly at WW as their SVP of marketing and is now doing tremendous work with the Ad Council. Next, we have Charisse Nunez, who is the insights lead of the Ad Council COVID-19 vaccine. She is currently leading all the insights and research work for this important campaign. She's a global insights and strategy leader with an incredible background in pharmaceutical, skin care, and beauty. And she is known for elevating business impact with incredible insights. And she is here to share with us the latest in terms of research and facts around COVID-19 vaccines, particularly around the Black community. Next, I would love to introduce to you the rest of our esteemed panel in no particular order. We're excited to have with us first our medical expert, Dr. Florencia Polite, who is the Associate Professor of Clinical Obstetrics and Gynecology and the Chief of the Division of General OBGYN at the University of Pennsylvania Perelman School of Medicine. We are delighted to have her here. She's a native of Philadelphia and a graduate of Harvard College and the University of Pennsylvania School of Medicine. I could go on and on and on, but we are happy you're here and really appreciate that. Next, we have Judith Wandu, who is Senior Associate Producer and Political Reporter at The Shade Room. We love The Shade Room. We're all huge fans of yours. Thank you for being here. As we all know, The Shade Room is the #1 most engaged platform across social media. Judith covers politics and everything in between, and she's interviewed everybody, just everybody. So thank you, Judith, for being with us today. And then our final panelist is Ms. Janae Bolden, who is a Senior Content Director with Bossip and Global Grind, other favorites, big favorites of ours. She's currently the Senior Director of Content at iOne Digital, Pop Culture, and she manages all of the editorial strategy for Bossip and for globalgrind.com. Again, I could go on and on and on with all of our esteemed guests, but I really am anxious to get to the heart of the matter. So before we have our media panelists engage with Dr. Polite, we'd love to have Sherry Thompson from the Ad Council provide an overview of the work that's being done by the Ad Council, specifically in the Black community. So Sherry, I'll turn it over to you, please.
Thank you, Kelly. Good afternoon, everyone. It's so great to see you today. And for the Ad Council, for our COVID-19 vaccine education initiative, our air game, which is, things that you're used to seeing, our national advertising campaign, and our ground game, what we're doing in the communities day in and day out, is equally important. And as we think about prioritizing different communities of color is a top priority for the Ad Council. And it's because we know that communities of color have been disproportionately impacted by this pandemic. We also know, and you'll hear more shortly from Sharice, that the vaccine confidence is lower in communities of color. So as a result, it has been a very key focus of ours for this campaign. And our strategy has really been around 4 areas. The first is around starting with working with culturally relevant agencies. That's why we're so thrilled to have Joy Collective on board, given their expertise, their relationships, and their proven track record in the Black community. We've also brought Values Partnerships on board, who are leaders in the space when it comes to faith. In fact, Values Partnerships was started by Joshua Dubois, who used to run all of the faith-based initiatives under the Obama administration. So having them be a key part of our team has been critical to our success. The second big area is around partnerships. It's community partnerships and it's partnerships within the faith community. We know community organizations, nonprofits are working day in and day out in the community. They have the network, they have the relationships, they also have the trust. And so we really are working closely with them to make sure we're providing resources that are a benefit to their members and really extending and complementing a lot of the great work that they're doing day in and day out. And with the Values Partnerships team in the faith-based space, we've built a national faith steering committee of 21 influential faith leaders from across the country, including Bishop T.D. Jakes, and it's been fantastic working with him and a number of other leaders. They are trusted messengers in our community. And so we've been working with them on developing content, leveraging their insights to inform our campaign, as well as working with them on national as well as local events. The next key part of our strategy is really around events and programming. We have been committed to providing platforms for culturally relevant conversations. And that's leveraging trusted messengers from our community to really make sure that we're best connecting with the Black community. Another key part of that has been events and town halls, but also media partnerships. Media organizations like BET and OWN, we know what they mean to our community, and working with them and developing custom content for their platforms has been a very key part of our strategy. And last but not least, it's around education. And so we have built a pretty robust online toolkit. In fact, go to blackcommunityvaccinetoolkit.org and you will see a number of different types of content, research highlights, email, social, PSAs. Even from a faith community perspective, you will see sermon guides. And again, we've done a lot of that work with Values Partnerships. And so we want to make sure that we're really extending the great work that a number of the community-based organizations are doing. A key partner of ours has been Black Coalition Against COVID-19, NAACP, National Urban League, even organizations like the Hustlers Guild, who allow us to really connect with HBCU students, which are so critical for us to connect with. So at the end of the day, it is so important, as I mentioned in the beginning, to maximize our air game, but our ground game. But we know the only way we can get through this pandemic is together. And one of my favorite quotes is, "Alone we can do so little, together we can do so much." And at the Ad Council, we know it is critically important to really connect with all partners in the work that we do so that we can extend and expand the work that all of these wonderful organizations are doing on the ground. So thank you again for your time today, and I look forward to the rest of the program.
And we are honored at Joy Collective to be working with you and for you on this critically important campaign. So thank you for that. Next, I'd like to open up the floor for our panel conversation between our esteemed media guests and our medical expert. So we have back here right now with us Janae Bolden, Judith Wandu, and Dr. Florencia Polite. And I am going to open up for the conversation. Let's start with Janae. I understand you have a question for Dr. Polite. So if you can please go right ahead.
Thank you so much for having me today, by the way. But Dr. Polite, so I have been vaccinated. I've gotten both rounds of the Pfizer vaccine, and I'm really eager to get to traveling. I recently saw that the European Union is going to allow tourism soon. But I have friends in Paris who say they're not even vaccinated yet. So how soon do you think it'll be safe to travel? And what kind of concerns should we have about places where the population hasn't been fully vaccinated yet?
You and I are similar in terms of what we miss most. Travel is a big part, and it's something we've missed a lot in the last 14 months. So a few things. One is most people who travel want to go see other people. And if the people you want to see are not vaccinated, the truth is you should just push pause, right? It's been 14 months. You're going to have to wait a little bit longer. The CDC is clear that international travel also poses an additional risk, which is that even you as a vaccinated person could come in contact with a COVID-19 variant that we were not expecting. And you don't want to be that vector who brings that back to the United States. So this is one of those times where you have to say, you know what? Let's just wait a little bit. And if we're traveling any place, even domestically, let's wait to travel until we are going to see fully vaccinated people, and wait until you're not only fully vaccinated, but 2 weeks after your last shot, right? You have to actually allow your full time for your immune system to be totally and optimally primed before you get on the plane. I just came back on a plane yesterday. I had the double mask on despite being vaccinated. I did the wipe down with the wipes on the plane, gloves and all. I mean, like literally when you're traveling, you're just in an indoor space with people who are certainly outside of your pod. So making sure that you're taking all those precautions would be necessary.
Absolutely.
That's awesome. And 14, did you say 14 months? We have to wait.
We've been in this for 14 months, right? It's painfully long.
Yes, absolutely.
It's not over us. So
no, I think it's great. I love that you said we don't want to be the vector who brings it back to the U.S. So appreciate that. Appreciate that. Judith, would you like to ask a question as well?
Yes. So my question is, I love being on Twitter, and I see that there's a conversation around women who say that their menstrual cycle changed after getting the vaccine. So I was wondering if there are any studies to show that this is actually true, like if the vaccine really caused this, and if so, how long would somebody's menstrual cycle be out of whack?
So great question, Judith. In medicine, we have something that's called true, and unrelated. So there certainly could be people who say my menstrual cycle is changed because of X. For example, I practiced in New Orleans after Katrina, and there were a number of women who said that their cycles changed after the major hurricane. And it is true that stress and other types of things that we know can change our cycle. But an mRNA vaccine that is not being incorporated into our DNA has no way that it should affect sterility or our menstrual cycles. Anything would very likely be related to the fact that we are stressed, anxious, that we're in the middle of our 15th pandemic, as I say, right? I really think we're underestimating the total amount of stress that we as women are under, that we've now taken on the role of teachers at home, that we are doing, homeschooling, working from home, dealing with the pandemic, dealing with what our Black boys and Black girls are going through with the police. Like, we have a number of reasons why we could consider ourselves perpetually stressed. But the vaccine as an actual causative agent, there's no medical reason why that would be the case.
Thank you.
That's great. Let's go back to Janae. Would you like to ask another question?
Definitely. So I think my next question is about the Johnson & Johnson vaccine. There were a lot of concerns about this vaccine. It was paused, but now it's coming back to market. Did something change, or was more research done? Was something tweaked with the vaccine? Why is it coming back out, and is it actually safe for people to take?
So great question, Janae. This was something that actually doctors disagreed about whether or not the pause should have happened. I actually was on the side that said, yes, when we are trying to gain trust from a community, if there's any outcome that seems like it's not what we expected, that I thought the pause was worthy. As you mentioned, the CDC and the FDA have allowed the J&J vaccine to be back on the market as of less than a week ago. The truth is that 7 out of 1 million women vaccinated with the J&J vaccine had come out with blood clots. And these were rarer than we expected. And certainly, I want to be clear about this, really rare in the grand scheme of things. Like your chance of getting this and actually having a really bad outcome from a blood clot was less than 1 in a million. So your chance of having a blood clot from birth control pills was substantially higher than the J&J vaccine. With that being said, it was something that was not expected. And I think the pause was worth it for us to evaluate, is there anything new in terms of the recommendations? And now that it's back on the market, they're simply saying, understand what the higher risk group is for the J&J vaccine, which would be women in their 18 through 50-year-old, still able to get the vaccine, but understanding that that group in the first 3 weeks perhaps should be monitored differently. I do believe it's safe. I think like anything else, we in the medical profession need to own our prior transgressions, and we need to make sure that we are being transparent with the public.
Thank you.
That's fantastic answer. Thank you so much. And, as Janae was talking about research and the importance of research and really understanding the facts, I would love to have Charisse Nunez join us from the Ad Council. She is the lead on all of the insights and research and will share the latest as it pertains to hesitancy and just what's going on in the Black community. So Charisse Nunez, turn over to you. Hello.
Greetings all, and good afternoon. It is always my great honor to join a forum where I could share the hearts and minds of the public, particularly as it relates to vaccine adoption and understanding what are really the barriers to vaccine confidence. So we've been monitoring this for the last 4 to 5 months. And what I can tell you now is there definitely is a positive news as it relates to the Black American population. Vaccine uptake continues to gain momentum. Right now, as of April, about 54% of Black Americans have been or intend to get vaccinated, which is actually not too far off from what we see with the general population, which is at 60%. There does remain opportunity. Right now, there's about 30% that have a wait and see mindset, and they do intend to wait anywhere from 6 months or longer. And some have even indicated that they're not certain when they would actually consider vaccination. And the reality is that they do express very genuine concerns about vaccination that at this point for them remain unaddressed. So throughout all of the work that we've been doing, the barriers to vaccine confidence remain driven by 4 key factors. And again, this has been consistent over time. There still remains questions around the speed of the clinical development process, as many still have reservations about the rigor of the clinical trials. We know that there's a general sense of distrust in the political and economic or corporate motives around the vaccine. And, I hear in speaking with the community often questions around the given immunity for the pharma companies on the legal action, et cetera. We've also know what looms large really are the concerns about the long-term adverse events. And many believe that the unknowns of the vaccine actually can pose greater risk than the virus itself. So as a consequence, many are seeking what I like to term as real world evidence that the benefits outweigh the risks. So they're waiting, they're watching to see the response of others that have already been vaccinated, and to hear those testimonials from friends, family, colleagues. As we've done our work here at the Ad Council, we've come away with some very key areas of focus from a messaging standpoint. And first and foremost, what I would say is that we have to stay the course in leading with empathy and set a tone by treating the questions with respect and acknowledging that this is in fact a personal choice. There's a decision-making process that everybody is going through. People will get there at different phases and stages. Some people are moving along the journey as not as a sprint, but as a marathon. So we do have to keep that into consideration. The other thing that's very important is that we should be empowering with the facts and with information. So what we have aimed to do at the Ad Council is inspire consideration by creating a surround sound of facts that confirm safety, and are transparent about what we know and what we don't know, and elevate stories that help to demonstrate, again, the benefits and the outcomes of getting vaccinated. So it really is about education, not indoctrination. And the fourth pillar is all around the emotional pull, really leveraging those moments of human connection that we've all missed, and highlighting that vaccination can be a pathway to eventually getting us back to life and the moments that we miss.
Thank you for that, Cherise. So important. And I just want to double click on a couple of things you said in terms of the messaging and the communication. Number one, starting with empathy. We know how important it is to do that in our community because we have very good reason to be distrustful given everything that we've gone through as a people. So I really want to acknowledge that we have a real distrust, and much of which is valid. So I want to acknowledge that. Second, I want to just say that we have created a suite of assets that are available to all of our media partners and community organizations that really do take into consideration those things that we miss most. We heard Dr. Polite and Judith Janae earlier talking about traveling and girls' trips, and we've created spots that look at getting back to girls tripping instead of solo sipping, and girls brunching instead of late night munching, and even going back to worship services, in-person worship services. We also know how critically important it is, as you said, Cherise, to acknowledge that we're not telling people to get the vaccine. We're just saying it's up to you. We know you have questions. Get the facts and get your questions answered at getvaccineanswers.org. So just in double clicking on that, I'd like to just share a new PSA that we just created that looks at getting back to college life. I went to Howard University and I miss homecoming. I miss seeing the drumline and the marching band and the Greeks pledging and all of that good stuff. So I wanted to share this spot. It's a new one that articulates and I think showcases what you just shared, Cherise. So this is called Let's Get Back to College Life. And then we'll bring our panelists back for additional questions.
COVID-19 has changed how we stomp the yard and feel the beat. Now it's time to take the first step that lets us get back to strolling instead of scrolling. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Is it safe?
Should I get it? Is it free?
It's okay to have questions. Now get the facts about COVID-19 vaccines at getvaccineanswers.org so you can make an informed decision for yourself and for your fam.
Love that spot. And it reminds me of all the things I want to get back to, including homecoming. And with that, I have a question for Dr. Polite. When is it safe for us to go back to large gatherings? There's talk of, when can we go back to Essence Fest in New Orleans? When can we, go back to Curl Fest? When is it going to be safe for us to have those big, large gatherings?
Oh, Kelly, your guess is as good as mine for that one. Just to be clear, that was not exactly my college experience, but I miss it nonetheless because I used to go to Howard's homecoming. I used to go to Essence Festival. And the thing is, we're a communal people, right? So we miss these exchanges. We do miss the opportunity to spend times. I did a vaccination day where I vaccinated 80 people, 70 of whom were Black. And every single patient I asked, what's the reason why you're getting vaccinated? What's the thing that you miss the most? And the things that we just mentioned were absolutely on that list. They missed church. They missed their grandkids. These were the reasons why people were saying, I'm going to take this leap of faith and get vaccinated. But the truth is we don't know. Large gatherings still pose a number of risks when we're bringing people from multiple households together. Again, there's this consideration of if there is one COVID variant and we have people who, even though people have been vaccinated, the larger the group is, we have to think of what is the chance that somebody in this group may not just be vaccinated, but may be still able to be exposed, right? So if our vaccine is 95% effective, that means that 5% of people, despite being vaccinated, still could be at risk of getting COVID. That's 5 out of 100. That's 50 out of 1,000. That's 500 out of 10,000. So the larger your group gets, the more and more likely you are to have people in that space who are not going to be immune to COVID-19. And then you add the variants, right? And then you add the immunosufficiency. So there's just a few things that we're just not ready for yet. And, outdoor gatherings are certainly better than indoor gatherings, but we don't know when we will be able to go back to business as usual. That's the honest answer.
Got it. Okay. All right. So the best we can do is be safe, wear our masks, get the vaccinations, all of that good stuff, and then wait and see. Okay. Judith, I'd like to turn it back over to you to ask another question.
Our roommates at the Shade Room, our audience, and people in general were a little confused and maybe reacted a little negatively to the news that we might need a booster for the vaccine every 6 to 12 months. But that sounds pretty similar to the flu shot, which we're all pretty used to. So could you explain the science behind why we need boosters?
Sure. So first off, I want to say, I just want to comment on the idea that the vaccine has been sort of rushed to market. One of the things that I learned that I was, when I was doing my own research, which I truly think that it's really important that we make sure we are telling folks, do your own homework, right? Go to getvaccineanswers.org, go to the CDC, go to your source and get some information. So one thing I learned was that the vaccines don't contain the coronavirus, which for me would have been a non-starter. Like, it was incredibly important to know that I could not get coronavirus from the vaccine. The second thing that I learned was that these mRNA vaccine technologies had actually been in existence for 15 to 20 years. So this was not something that just happened since, January of 2020, that the concept of a vaccine that could be used to literally be a prototype where it just tells our body what to do had actually been studied here at Penn, where I work, since 2005. It's already in the making to look at things like cancer and herpes and sickle cell. So it's pretty awesome that then there was this pandemic that they were able to say, can we use this technology for this particular strain of coronavirus? So the boosters come into, well, what are we learning about coronavirus? One of the things we're learning is that the strains that we're seeing now aren't exactly the same strain that we saw in March 2020. So the idea of the flu shot, like you mentioned, is something that we're just used to, where when you have a virus that quickly mutates, you have to actually yearly try to actually address that. Our hope is that the current research will be able to get us a vaccine where it will be more like tetanus, where you get a booster every 5 to 10 years. And that's what they're working on now. But we have to remember, we've only been in this for 14 months, right? Even though the technology has been in here for over a decade, we are still learning how to fly the plane while we're on the plane, right? Like, the things are changing. Literally, they're changing monthly. And so we have to allow for some degree of just, medicine doesn't know all the answers right away. We're still figuring it out. And the good news is that we're trying to be transparent with the public in a way that I don't think has been the case in the past. So that, for me, is the reassuring thing that we can tell patients.
Yeah, absolutely. The transparency is so key, I think, so critical. Janae, feel free to jump right on in.
Sure. So you addressed this a little bit with my travel question, but I do have some friends who have not gotten vaccinated and do not plan to. Is it safe for me to be around them if I wear a mask, or is it just like I should just avoid certain people until they get vaccinated? What do you think the safest way is for me to interact with my loved ones who are being stubborn about the vaccine?
Well, first, I want to go back to what Sharice mentioned about what we can do in terms of hesitancy, right? There's a ton of different reasons why people are hesitant. I think it's incredibly important that we do address what their hesitancy is, right? So if we can, getting them vaccinated would certainly be our first option. And so I would say, let's dig into what is the reason why they're hesitant. Is it just the time, right? Is it we just don't know enough? And for those folks, I say, well, we do know a lot about coronavirus, right? So even though we may not know enough about the vaccine, we know a lot about the safety of the vaccine in the hundreds of thousands of people who've now been vaccinated. And what we're learning about coronavirus is even people who were never hospitalized, who were never intubated, who had a mild case of coronavirus, they are showing lifelong lung problems, gastrointestinal problems, cardiovascular problems, mental health problems with anxiety and sleep disturbances. So when they say we don't know a lot about the vaccine, I remind them that we do know a lot about coronavirus. And what we know is not particularly good. If they're still,
Right.
like, it's just not going to happen forever, and this is grandma and you want to see her before she passes away, then yes, I understand. You got to sort of negotiate that, right? Certainly seeing her with a mask, certainly seeing her distance, and if you could see her outside. And for my, I'm an OB, so for my pregnant patients who are delivering, I tell them absolutely not for their newborns who don't have any ability to be, to sort of be immunized for COVID. They should not see family members who are not vaccinated when they have a newborn baby. And so some of those protective things we just have to outline for our families, that there are certain markers. For the Polite household, we only see vaccinated people. If you are not vaccinated, you don't get to come into our house. We will not have an outdoor dinner with you. For us, that's just a hard pass right now, because the risk for us is it is too much. It's too risky.
Wow. Okay. So I thought it was okay that you could actually see people as long as you had a mask on. You're saying no.
I think you have to still assume there is some risk though, Kelly.
Yes.
Right?
100% get that. And I just want to keep it 100, because I was thinking that I could have a couple of friends, put my mask on, we'd be okay, take off, sip a little wine. We are all good.
That's the thing, Kelly, that you just mentioned. When are we seeing friends that we don't eat and drink with? Right? You just mentioned the exact point that we always have to pinpoint, which is, what exactly are you doing with your friends? Are you just sitting out in the park with mask on? Sure, you can see your unvaccinated friends, but that's not what you're doing. We are having these events where we, again, as a communal people, like to eat and drink. And so once we eat and drink, what does that mean? You can't eat and drink with a mask on. So now
we're saying it's not an event. It's a little one girlfriend at a time, maybe, across the way.
So Kelly, let me tell you, in the heart of COVID, we didn't have a single healthcare provider who got COVID from a patient. Even our patients who were floridly COVID positive, who were intubated, all of the transmissions that we had in the hospital occurred at the small events that you just mentioned.
Right.
At the very small Mother's Day thing that used to be big, that's now just me and my sister and my mom. It occurred at the girls' weekend, where I swear we were all going to be safe because we all quarantined and we all said we were doing something that we were doing. Did you guys see the episode of Blackish about quarantining? Yeah. Where everybody thinks they're quarantining, but my quarantine isn't your quarantine, right? And in these small spaces where we're going to take off our masks to eat and drink. And so now we're exposing ourselves to people who were not in our bubble. And once one person gets COVID, it just happened to a friend of mine and her girls' trip less than 2 weeks ago.
Got it. Okay. Super helpful. Judith, back over to you.
Okay. So, a lot of vaccination centers are experiencing a major decline in new people coming in to get vaccinated after the whole Johnson & Johnson controversy. So what do you think needs to be done to regain public trust, in the vaccine after they just, said, okay, you can get it again. And now people are like, because I had a friend who actually got Johnson & Johnson. She said she watched one of my interviews, was like, I got vaccinated because of you. And then 3 days later, the Johnson & Johnson news came out. But I'm like, the odds of you might get struck by lightning before you get a blood clot from Johnson & Johnson. But, what do you think should be done to regain public trust?
I think we have to stay the course. Actually, I think it's a lot about what Sharice talked about. We are going to have to give people time. And this was a setback. And just to be clear, it wasn't our first setback. I got my second shot of the vaccine on January 6th. That was a setback, right? When I watched what happened at the Capitol, I said, so for all of my brothers and sisters who think there is, there are two different Americas where Black people might be getting a tainted vaccine and everyone says that's ridiculous. And then you watch what you saw at the Capitol and you realize there's a reason why we actually are concerned about what we in our communities might get, right? To me, that was a setback. And we just have to stay the course. We just have to keep reminding people that the vaccine to me is the only way that I see out of this pandemic. I just don't see another way. It's the toughest year of my 20 years in medicine. I have seen patients, family, friends die, lose their jobs, not be able to practice anymore, not be able to regain their normal sense of being. And so for me, this is the only way that I see out. And that's what I ask people. It's like, what are the ways that you see us moving past this pandemic? And understand that, like you said, the chance of actually getting a blood clot from J&J is literally like 1 in a million. It is super, super, super rare. But it was still the right thing for us to do, to say to the public, look, if we have any reservations, we should just take a pause. And we took the pause, and I think that's the right thing to do. But we just have to stay the course.
That's great. We actually have a question in the chat. It says, I heard Pfizer is working on a COVID antiviral pill. Is that the samosa of a vaccine or a cure? That's the question.
I am unfamiliar with the pill. I'm not saying that they are not. I'm just unfamiliar with it right now. I wouldn't be surprised if at some point we can make this happen as a pill format. We can do colonoscopies as a pill. So I'm sure that they're at some point going to work towards that. I don't know when that's going to happen though. And a cure for any virus is hard, right? It's the same reason we don't have an absolute cure for herpes or a cure for HIV, because they do mutate so quickly. It is hard for us to come up with a one-stop shop that cures it forever.
Got
The
it.
goal instead is to get herd immunity, to get so many people vaccinated that one person who has the virus can't actually infect anyone else because everyone they come in contact with has already been vaccinated. That's the goal when you think about eradicating a virus.
Got it. Cool. Thank you. I'd love to ask Judith and Janae about what's happening in your worlds, your work environment. What's happening with your coworkers? What are people talking about? What's the conversation like with your peers within the media world that you're in?
I guess the big thing for my staff, most of us are vaccinated. We call ourselves Vaxies. We were actually joking this morning about the whole, the new "you can't sit with me" is like, if you're not vaccinated, you can't hang out, that kind of thing. So we're pretty pro-vaccine amongst my staff. I actually tested positive for COVID in January. Mm-hmm. So I have antibodies on top of the vaccine as well, but I'm still trying to be cautious because I am a caregiver. My 71-year-old mother lives with me. So that's always a big concern for me, just not exposing her to any more risk. Now, I happen to live in Atlanta, which has not been one of the most safe places to be during the pandemic. It's been pretty open. The joke here is that the cure is in the hookah, which we all know. I'm sure Dr. Polite would tell us there's no cure in the hookah smoke in Atlanta. But the way that people behave here has been as if it does. But in general, I think we're all in the media staying very informed. I've seen a few other panels like this. But again, our community is very skeptical. Of course, there's always, the knowledge of different experiments, the Tuskegee experiment being one. My father is a dentist and he works in public health. So I've always been really super aware of the things that have been carried out against us by the medical community. So it makes sense that there's distrust. And I love that all of these concerns are being addressed in the campaign. I also am fortunate to have friends who, one of my friends, Anne Graham, her father is a scientist who worked on the Moderna vaccine. So I talked to her extensively about that and have felt a lot more at ease, kind of being like, well, I kind of know the guy that made the vaccine. So telling everyone, I think it's okay. My friend's dad made this vaccine. So I think it's a constant source of conversation because what else is there to talk about after 14 months of being in shutdown, especially who have been, cautious. We're all super, we've taken these precautions. We're ready to get back out there and we're educating ourselves about the safest way to do so. So I think that's really the media response in general, especially amongst the Black community.
That's great. And would you agree, Judith?
I mean, yeah. So in my community or working here with TSR, we do a lot of production. I recently flew to Minneapolis to cover the protests outside the Derek Chauvin trial. And then in January, I flew to DC and, it's just because we do a lot of production, we're all on the same page. Let's get vaccinated because we have to do COVID tests before everything. And we're we don't want one negative COVID test to ruin. We actually had that happen. It ruined an interview with Bow Wow or something in Atlanta when one of our team, our entertainment reporters went out there. And we were oh yeah, so we got to just be a little bit more careful. So everybody was down, Moderna is pretty much what we mostly got. But Also, just like on a social level, like my friends, like they nicknamed me Vaccine Waters after I got my vaccine a little earlier than them. And they were like, yeah, we went to Miami, we had a good time. I know it's not totally safe, like, to fly on a plane and be around such a large crowd because the streets were really packed in Miami. It was crazy. Mm-hmm. But that was fun. But it was just, that's just kind of like the wavelength we're on. But we see that there's kind of a big difference between what we're on and what the audience is on. Like our audience doesn't fully trust the vaccine at this point. Like you mentioned, Janae, like Tuskegee, that keeps getting brought up. And in general, people would just, like the distrust, like, okay, how do we know that they're sending the same type of shot because we live in insulated communities. It's very easy to, if for a conspiracy theorist in their mind to think like, oh, okay, there's different shots going to Inglewood than are going to Beverly Hills. So I don't know. Our biggest goal is just what we're trying to do is inform everyone, but not make them feel like there's some sort of like hidden agenda or like we're getting paid people like to get the vaccine and this and that. They're like, Michelle Obama, if I see her get it, then, I'll do it unless she did. But that's just generally where we're at right now, is trying to build that trust with, our audience.
Trying to build that trust is so important. And Dr. Polita, I see you wanting to jump in.
I mean, just to say a couple of things. First off, the fact that both of these young women brought up Tuskegee, right? I mean, and
Absolutely.
I think we as a medical profession really do have to make sure that we don't just say, no, that was a long time ago. Like, we have to own the fact that Tuskegee was a while ago, but there's still medical atrocities that are happening to people of color. And this is an example of one, right? When we think about why, our people were dying at 2 to 3 times the rate of white people of COVID, it was not because of race, it's because of racism, right? It's because we had the jobs that didn't require, establish PPE early on, like working in sanitation or working in the grocery store, or all these, having the multi-generation home that Janae mentioned. So the young person goes out and gets COVID and comes home and now they give grandma COVID, right? So there's so many ways that I look at this as like the 3-headed beast when it comes to coronavirus and Black people. The first is we were dying at a higher rate. The second is we have hesitancy that is absolutely well-earned and well-deserved. The third is that we actually watched this country have a disparate rollout of the vaccine, right? Even the rollout that was supposed to happen in our communities, you had people dressing up and coming down from the suburbs to the cities, taking the vaccine that should have actually been for our people. So this is like a 3-headed entity that we're trying to fight at all these different places. And the truth of the matter is we have to actually address each of those. We can't, to me, just focus on one specific thing. Like the hesitancy is as important as the access, because once we have folks say, I want to get vaccinated, we have to make sure there's a place where they can go to get vaccinated, right? We don't want them to have no barriers set up. Once they agree, we need to say, okay. And, you got Judith over here who's acknowledging that their young group is going to still do the things they do. So to me, let's get them vaccinated so that they can actually feel comfortable doing these activities.
Absolutely. The young people and the old people, like myself. Go ahead, Judith.
Okay, so I looked at a Pew Research poll and an NBC poll, and there's some hesitancy in the Black community getting the vaccine, but compared to certain groups like white Republicans and stuff like that, Black people are more interested in getting the vaccine than quite a few ethnic groups. So, is there any kind of like inequity in, our access to the vaccine in our communities? Because it doesn't seem like our hesitancy is the real reason we're being under-vaccinated. It seems also like access is.
It is absolutely both. We have the hesitant group who, just to be clear, the hospital group is a great group to look at for hesitancy because access is not our issue, right? Anybody in the hospital has access to the vaccine if you are a healthcare worker. So when we have differing numbers, which we did and which a lot of hospitals do, we can say that is 100% hesitancy because access is not the issue. When we look at the community at large, Judith, that's a different question. And that goes to your point about access, which, yes, we've seen our major name drugstores, vaccinating 20 white people to 1 Black person or setting up vaccines not in the major cities. So access has been a huge issue in the communities of color. So that's the second part of what we have to address. There's a lot of healthcare centers that are doing something similar to the Ad Council and Joy Collective of actually partnering with faith-based organizations. We have one at Penn called Mercy, Penn Medicine, and the community. And it's literally meant to say, we're going to vaccinate on Saturdays, just the Black and brown community, to try to address the fact that we know there has actually been unequal access to the vaccine. And there are other healthcare centers that are doing that across the country. There's other, churches that are partnering. We have to basically overcome that inequity as well, which is, again, that's our struggle, right? We're always having to fight 2 and 3 battles in order to be able to be on the same ground, which is just really unacceptable.
And isn't that true for our lives, right? This is the whole twindemic, as I heard Dr. Cameron Webb say last week. Like, this is just one huge issue that we face as a people, in addition to so many other issues. And so it's also one thing that we can control, and as we can go get it if we choose to. It's something that we can control for ourselves and our families. Judith, did you want to say one last thing? I saw you getting ready to say something.
Oh, no. I'm good.
Okay, cool. Awesome. Well, I just want to say, on behalf of the Ad Council, COVID Collaborative, and Joy Collective, thank you all for being here today. This was a tremendous conversation. I've learned a ton. I really, really appreciate all of our speakers for being here with us to share the facts, to share the information, to ask your questions. Judith and Janae, and for Dr. Polit for being so incredibly valuable in terms of sharing such incredible knowledge with us today, and all of our listeners. So I do want to just say thank you so much for being here and sharing your time with us. Thank you for people who have been watching, and for any partners who are looking to get involved, whether you are a media outlet or a community organization. We have a tremendous suite of assets, creative content that is available for you. You can download that at blackcommunityvaccinetoolkit.org. You can also reach out to me directly at Joy Collective, Kelly at joycollective.com. You can also reach out to your Ad Council representative, especially if you're a media partner, to see how you can support us. We are creating content with partners. We are working collaboratively with many organizations, like Sherry mentioned earlier, whether it's BET or OWN or the Shade Room or Global Grind. We want to work with all of you, and we really appreciate your support. So please check out the resources, whether it's getvaccineanswers.org, blackcommunityvaccinetoolkit.org, or cdc.gov/coronavirus. And again, on behalf of the Ad Council, COVID Collaborative, and Joy Collective, thank you all for being here today. Have a wonderful afternoon. And we're going to close out with a spot that's all about getting ready for getting back to brunch. So here's to brunch and to a wonderful afternoon. Thank you for being here.
COVID-19 has changed how we spend weekends with the girls. Now it's time to take the first step that lets us get back to brunching instead of late night munching. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Should I get it? Is it safe? Should I wait?
It's okay to have questions. Now get the facts at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.